Okay, so whilst we are waiting, I think I see two of my speakers online. Like I said, I see Mary and then Priscilla. I don't see Belinda. I don't know if she's joined with a different name. Hello, Priscilla. Hello, Priscilla. Can you hear me?
Hello, Dr. Liz.
Yeah, Priscilla, how are you?
I'm very well. How are you?
I'm fine, thank you. Um, is Belinda online? Have you been able to reach her today?
Mm. I spoke to her earlier. Yes.
Okay,
I expect her to join, but I'll text her now to see
okay,
what's up. Yeah.
all right. I'm sure maybe she's joining us. So let's give everyone a couple of minutes. We have 1 minute left and then we'll start. So kindly remind her to join before we begin.
Yes, please.
Thank you. Okay, good evening, everyone. Once again, and a warm welcome to today's session of the Communicate Health Impact Sleep Practical session. So if you are new to RTC or this is your first time joining any of our initiatives, Communicate Health Impactfully was a workshop, a 4-day intensive public speaking training workshop we organized. And then after the workshop, this practical session was set up as a way to guide participants to help them improve their public speaking and to also communicate health impactfully, just as the program intended. So if you are new to RTC or this is your first time joining us, you are warmly welcome. If you are part of the family already too, thank you so much and welcome again to today's session. We've had one session previously on shisha, the effects of shisha and smoking, and the impact out there was actually quite great. Even today, I saw Dr. Bennett post a testimonial again from someone who said they were blessed by the message that we shared. So it is the same thing that we are carrying on today. And today's session is one that is particularly dear to my heart because I am a women's empowerment advocate and I love everything women, everything concerning women's well-being is something I am particularly very, very interested in. And so today's session, to introduce myself, my name is Dr. Elizabeth Fovikashi. You can call me Dr. Les for short. And from my title, it's obvious that I'm a medical doctor, but I don't just wear the hat of a medical doctor. I am also a passionate advocate for women's rights and everything that has to do with empowering women to thrive well, whether in the area of health, career, their business, their lives. Even though I'm a doctor, I do not limit myself to just women's health. I am passionate about helping women become who they are to find themselves and really live up to the purpose that God has created them to be. And so today's topic is about understanding and then managing our period health, which is a critical aspect of women's health. And so I am the moderator for today's session, and I'll be joined by three able speakers. And for now, I can see two of my speakers online in the persons of Miss Priscilla Daniel and then Miss Mary Ejubi. So I would like to ask them, Dr. Priscilla, have you been able to reach Belinda, please?
Yes, Mary called here, so to join us too.
To join, okay. All right,
Hi,
so if
Dr.
that's fine. So I will introduce my first speaker, and then without further ado, we'll just get into it. So the first person to start the presentation for us would be Dr. Priscilla Daniel Amegashi, and she is a PharmD student and a passionate female reproductive health advocate, which makes her the perfect person to even be educating us and teaching us about this topic today. She's passionate about adolescent reproductive health, and she works to empower young women through education, mentorship, and access to accurate and relevant health information by merging her pharmaceutical care with health advocacy. So as you can see, Dr. Priscilla is a multi-dimensional person. Even though she's a pharmacist, she's not limiting herself to just pharmacy. She's also interested in female reproductive health, and she's a budding voice in that area, helping women to make confident decisions when it comes to menstrual health and hygiene. Dr. Priscilla also manages a business, so she's also an entrepreneur known as Megdan Jewelry. And through her brand, she expresses her love for fashion and then styling. So with a round of emojis, as we cannot visibly clap, let us welcome Dr. Priscilla to begin our session for us today. Dr. Priscilla, the floor is yours. You can go ahead. Thank you.
Thank you very much, Dr. Liz, and thank you all for joining us this evening. Please, just a minute. I want to.
Sure.
Dr. Liz.
Hello, Priscilla.
Yes, I'm not able to share the slide. Only the host can do that.
Okay, so Dr. Bennett, if you could please allow Priscilla to be able to share her screen so that she could project her slides, please.
I just did that, so
Okay,
kindly let her
thank
do
you.
it again.
All right, thank you. Hello, Dr. Priscilla. We are waiting for you. Dr. Bennett has allowed you to be able to share the slides.
Yes, please.
Okay.
I'm on it. Just I'm so sorry. I have to use my phone. I'm not able to join with my laptop. So
But if any of the other two speakers can join with their laptop, maybe they could help with their projection as well. Hello, Mary. Are you Mary? Okay, you Priscilla, you carry on. I think this is fine as well because the slides, I can see the slides. I don't know for everyone else. Can everyone else see the slides? It's fine
Yeah,
at
Dr.
my.
Liz. Hello,
You
Dr.
can see
Liz.
the slides. Hello.
Yeah, please, I'm joining with my phone because my laptop is faulty currently.
Oh, okay, no problem. But I think if I can see the slides. So if you can see the slides and it's fine, you can just drop it in the comments and then you can go ahead.
Okay. So please, can I go ahead?
Yeah, Priscilla, go ahead.
Okay. Good evening once again, and thank you all for joining us. So tonight we'll be talking about menstrual cramps and how to manage them. Before I get into the slides, I would like to share a short story. Yes, just a short story. So when I was in SHS, I had this friend who would have severe cramps, worse than I have ever seen. Would usually have very painful cramps. She would have nausea, she would vomit, she would have excessive diarrhea. And mind you, she used to take some drugs for this, but it didn't seem to help, especially within the first few hours. So this used to affect her going to class. She would usually spend the first 2 days in the sick bay. Yes. And then on the other hand, there's me. During my menstruation, I don't usually experience that much of pain. Even though on some months it gets intense, usually all I'll get is mild discomfort. And then there are a group of other women who have never experienced period pain. So what I just explained to you is three different groups of women who are all going through menstruation, but their experiences are different. This is not because some of them are faking it. This is not because some of them are soft, but it's just a result of how their bodies are reacting or how their bodies are handling the changes that come with the hormones that are released during menstruation. So you usually have people say that why is it that this person is able to go about their normal activities when they're on their period and this person is not able to? They call them lazy. They say all manner of things. That is not true. The only reason why some women handle it better than others is because of how their bodies react to the changes that are happening. So in today's presentation, we'll be talking about the causes of menstrual cramps, the symptoms that come with them, and how to effectively manage them. Menstrual cramps is something a lot of women go through, and most of them endure this pain in silence. According to studies that were conducted among women in Accra, they found that about 74% of women experience painful menstruation, with 82% of this number experiencing the pain for 1 to 2 days during the period. This tells you that a lot of our women endure this, a lot of our women are going through this, and this is something that we shouldn't keep quiet about. This is something we should talk about, as it is a way we can also extend our support to the women that are going through this and help them better. So by the end of this presentation, I would hope that every one of us will understand what menstrual cramps is, how they come about, and even for the men here, we better help our women, be it our mothers, our sisters, our wives, we'll be able to give them the support that they need during this period. So what are menstrual cramps? Menstrual cramps are painful sensations in the lower abdomen that occur before or during menstruation. Usually, women will feel this pain in their abdomen, their lower abdomen, like I mentioned earlier. Some will also experience pain around their waist. This pain can radiate to the lower back and also to the thigh. For men who have never, for men who don't know anything about how this how menstrual pain. I would like you to imagine the massive pain, that you have when you have a massive pain, when you're playing football or you engage in any rigorous activity, the pain that you feel in your calf. Just at this time is appearing in your lower abdomen. And mind you, this pain is not relieved when you sit down or when you take a break from that activity. It's usually prolonged. It takes hours, even sometimes. So this is the pain that we are talking about. Apart from the pain that comes with menstruation, some women have other symptoms showing up. Some have diarrhea, there's vomiting, there's fatigue, and then there's diarrhea. Typically, this pain will begin a day or two before the period or on the day of the period. So dysmenorrhea is basically the medical term for menstrual pain or period pain. And there are two types of it. We have the primary dysmenorrhea and the secondary dysmenorrhea. For the primary dysmenorrhea, the pain that is felt is basically as a result of the hormonal and physiological changes that occur during menstruation and not due to any other medical condition. And usually it would take a pattern. You have some women telling you that, oh, I have my pain. I usually experience my pain a day before my period or a day or two. Some will say they have their period on the day of their period. So for primary dysmenorrhea, you see that there's a pattern. That means every other menstruation they have, or whenever they're on their period, they will see that maybe this particular time I experience the pain. It means my period is about to come, or yes, or you're experiencing it on that day. However, in secondary dysmenorrhea, this pain is not only associated with the changes that are occurring during menstruation. You have other condition contributing to the pain that is occurring. Usually, an abnormality or an infection in any other reproductive organ. This pain usually comes very early, even before the menstruation. You have it some days before the menstruation. It can last throughout the menstrual period, and you have the pain even after the flow has ended. Conditions that sometimes result in secondary dysmenorrhea include endometriosis, fibroids, and pelvic inflammation. So how does this pain actually happen? So what happens is when you start before your menstrual the menstruation starts, certain chemicals called prostaglandins are produced. And what these prostaglandins do are to help in the contraction of your uterus to expel your uterine lining. So these strong contractions that happen are what will result in the pain that you feel during your menstruation. So usually the prostaglandins are at their highest levels just before or on the day you start your menstruation. That is why the pain on those days are severe. But as the days progress into your period, maybe day 3 onwards, you realize that the pain subsides because most of these prostaglandin levels have reduced. Another thing that we should note is some women produce higher levels of prostaglandins than others. That is why in like the example I gave three groups of women. You have some experiencing extremely excruciating pain during their period, some not so much, and then some don't even experience pain at all. This is because of the levels of prostaglandins each group is producing or releasing during their period. So at this point, my colleague Mary will take over from him. Thank you.
Wow, thank you very much, Dr. Priscilla, for that wonderful introduction and beginning to the lecture. I'm sure a lot of us are already learning. I, for one, have learned that the period pain is not just one type. because after all, you might be tempted to believe that every woman's period pain is the same. But from our session, we are already learning that there are types to the period pain and it's different for most women. And then there are women who are God's favorite daughters who don't even experience anything at all. So I'm learning a lot already. I would call upon Mary Ejubi to go on with the second session, which is the physical and the emotional symptoms that result from this period pain, and also to go ahead and teach us how we can manage it effectively at home. So go ahead, Mary. Is Mary with us, please? Is Mary still on the call with us, please? Yeah, I see Mary's name in the participants, so she should still be here with us. Hello, Mary, can you hear me?
Yes, Dr. Liz. Sorry, I wasn't able to unmute. That's why I delayed.
Oh, no problem. So you can go ahead.
Okay. Good evening to you all. Please, I will continue from where my sister ended. So now we know dysmenorrhea. We have two symptoms of dysmenorrhea. We have the physical symptom and the emotional symptom. With the physical symptoms, we have the cramps and pain. Yes, that's the pain we feel in our lower abdomen before or during our menstrual period. And this pain, it ranges from mild to severe. Others will experience it severely, while others will have it mildly. But it's not all. Even some can feel that pain in their lower back or even their thigh. It depends on the individuals. Now, let us look at the digestive issues. We have the nausea, the vomiting, diarrhea, and constipation. During this period, I remember in SHS, I have this friend, during her menstrual period, she's always vomiting, and then sometimes she has to be admitted at the hospital. Some even thought that maybe she's pregnant. No, but she wasn't. It's how her body reacts. So during that period, she'll feel nausea, even as a pregnant woman, some will vomit. And with the diarrhea and constipation, that one depends on individuals. We have some individuals who have constipation during their menstruation, whilst others will have diarrhea. It all depends on the body mechanism. Now, let us look at the number three. We have fatigue and headaches. Yes, the person become restless, become tired easily, even when you have not done anything, because the body is changing. And also, there is this headache. Others have had a mild headache, whilst others too have severe one. That one too depends on how your body is reacting to dysmenorrhea. Now, we will look at the emotional symptoms. With the emotional symptoms, we have mood changes. Yes, this one we popularly call mood swings. So this one, the individual will be smiling at a point, happy, laughing with her friends. Then suddenly the person will become moody. It's not like someone has said something bad to her or she's feeling pain or something. No, it's because of the emotional, the dysmenorrhea she's going through, the pain that she's going through. So they become moody. We have the emotional distress. The person becomes anxious, depressed, and then sometimes they feel hopeless. Meanwhile, to the person currently she's not going through anything, but the person can remember what happened to her some time ago, and then she will dwell on this thing. So if you are if you're an individual who during this period you have to try and then surround yourself with people who can boost up your energy or do things which can boost your energy so that you don't dwell on these feelings. And also, if you are individual who is around such a person going through dysmenorrhea, try and then mind the words you say or how you act around the individual, as this can also affect her. We have social impact. So this one too, the person will feel like the person wants to be alone. The person will isolate herself from friends. If she is that lively person, extrovert, suddenly she don't want to go anywhere. She just wants to be in a comfort zone. She wants to be alone. These are also symptoms of it. And this can also affect the work productivity at work. Let's say this person is a fast, she's able to do everything fast, but during this period, she will go to work and there's something that normally she will use, let's say 30 minutes to do. During this period, she will use like 2 hours or even more to do that same work. Because of the pain she's going through, she's not able to be her normal self or do things she's able to do when she is on her period free. So now we will go to how we can, some of the things we can do in the house to help relieve this pain, to help lessen these mineral cramps when we are in our period. We have the heat therapy. So this one, you can use heating pads. You place it on your lower abdomen, especially where you are feeling the pain. This will help calm the muscle. But don't worry if you don't have heating pads. This one, I was taught in JHS. One teacher told us that when you're feeling this pain, you can pour warm water in a bottle. Then you wrap a napkin around it and you can place it on your lower abdomen. As all this help calm your uterine muscles, thereby reducing the pain. And also, women are encouraged to take warm shower during their period, as this also help in improving blood flow. We have the natural remedies. We have the chamomile tea. We have the ginger tea. All these teas, they are herbal teas that help the body to relax and also improve relaxation. And then we are also encouraged to take in food that are rich in magnesium. As you know, magnesium relaxes the muscles and then improve blood flow. So at this point, it's going to relax your uterine muscle, which also improve your blood flow. And some of the food rich in magnesium, we can find some in nuts, legumes, green leaf vegetables, and then, oh, sorry, I can see my presentation, the PowerPoint is off.
Is Priscilla still the one sharing her screen, or you were sharing it?
No, Priscilla was sharing it. Okay, let me
Priscilla.
share.
Okay, if you can also share yours. But it's Priscilla who has been made co-host, so she's the only
Yes,
one.
I'm not able to share.
I'm coming. Let me.
Hello, Priscilla.
Hello, I'm so sorry.
Okay.
I'm sharing it again. Just a minute.
Okay.
Yes. Please, can you see?
Yes, I can see. Can you go back to, yes, thank you. Sorry about that. So, those food, that's the legume, the green leaf vegetables, and the nuts, also, they are rich in magnesium, which also help relaxes the muscles and they improve blood flow. And also, there are some lifestyle approaches that we can do to help reduce dysmenorrhea. We have exercise. We are encouraged to do exercise, not vigorous exercise, at least more exercise like running 30 minutes or even walking fast around your neighborhood. This also helps improve your body and your blood flow. We have the acupressure, that's applying pressure on your lower abdomen or especially where you are feeling the pain, as this also helps reduces the pain. We are also encouraged to eat more balanced diet food. Yes, so try to take in food that are rich in all the essential nutrients our body needs. So this will help in your blood flow, your body mechanism, and also helps reduces the pain. And we are encouraged to stay away from alcohol, caffeine, and food that are rich in caffeine, and then other stuff, as this also increases the pain we feel during our menstrual period. So these are some of the things that we can do in our home. This one, you can do it in your comfort of your home. You don't have to go anywhere. You can do it so that it will help reduce your pain, and then you'll be able to do your work effectively and then go about your duties. Thank you. My colleague will continue from here.
All right, thank you very much, Mary, for that wonderful continuation as well. So I would like to just make a small correction. I didn't introduce who Mary was before she began her presentation. Sorry about that, Mary. So Mary is a radiographer intern and a passionate social impact advocate, and she's committed to using her voice and platform to drive positive change within the healthcare space and in underserved communities. She has hands-on experience in medical imaging and a growing presence in social impact advocacy, where she's bridging clinical knowledge with her passion for community engagement. So thank you very much, Mary, for once again bringing your knowledge to help us, because this presentation is also your way or another way that you are impacting the community as well. So the next and the last speaker, but never the least, is Miss Marilyn Belinda Asantua-Jaman, who is also a 400 level nursing student at the Methodist University of Ghana, Dansoman. And she is hoping to be the best nurse and the voice of health to the whole world. So Ms. Belinda will continue, and she will take us through the medical management of dysmenorrhea or period pain, and whatever myths or misinformations there are out there about period pains. She will also help us to debunk them this evening. So Ms. Belinda, the floor is yours. You can go ahead. Is Miss Belinda with us, please? First of all, let me check. I am not seeing. Okay, I think I see her name as part of the participants. So Belinda, please, can you hear me? Okay, she says she's not able to unmute. I don't know. Let me see.
Thank you very much. Good evening, everyone. Please, I will be taking us through the medical management, the method, and the conclusion. So I'll start with the medical management. One, we have the pain relievers. Others call it the over-the-counter pain relievers. So when we talk about NSAIDs, pain relievers, normally we are talking about NSAIDs, which is the non-steroidal anti-inflammatory drugs. For example, is the ibuprofen, the naproxen, and all that. And it helps to reduce pain and inflammation. So with a situation where we are having a painful menstrual cramps, severe one, and all that, one thing that can help us to reduce this is the pain reliever or the NSAIDs, and normally is prescribed by the doctors for us or a nurse, an experienced one at that. We have the hormonal methods. With the hormonal methods, birth control pills or other hormonal methods can help regulate the menstrual cycle and reduce symptoms. It's a minute. And the hormonal birth control also it thickens the it actually reduces period pain and discomfort, and then it helps to thicken the uterine lining, which makes it less likely for a fertilized egg to implant. It has a lot of benefits, but we are talking about menstrual pain, so it helps to reduce period pain and discomfort. It helps with some mood swings. It helps to reduce the mood swings and other stuff. So that has to do with the hormonal birth control. Then we have the prescription pain relievers. In severe cases, a healthcare provider may prescribe stronger medications such as prescription pain relievers, could prescribe different kinds of pain relievers, such as and beside the painful relievers or the prescription pain relievers, we have types of them. And then we have the one type is the opioids, which is strong pain relievers that can be reduced strong pain that can be reduced, such as the oxycodone or the hydrocodone. Then we have the second one to be the non-opioids, which is medications like the acetaminophen or the NSAIDs, which I mentioned earlier, which can help with pain relief. So we use that, or the doctors prescribe that to relieve chronic pain, acute pain, menstrual cramps, any kind of pain. This has to do with the severe cases. So you don't just go and get the medication, but then the doctors or the nurses go to details or find out if you are able to take the medication or not. Maybe there could be an underlying condition which could not let you take it. But then in the severe cases, they do all this to prescribe the medication for you. We have relaxation techniques which can also be told us by our doctors and nurses, which my sister said earlier. So you'll be with the relaxation techniques. For example, is a deep breathing or meditation. That's a yoga. We can do that as well to relieve us of stress and improve our mood in case we have mood swings. We have the hydration. That's we taking in a lot of water. Actually, during this period, most of us don't like to eat. I mean, example, when you are in your period or you have painful menstrual cramp, you don't feel like eating anything the whole day, you wouldn't want to eat. But then it's best to take in lots of water in order not to stay dehydrated. And it helps to reduce bloating and discomfort. Here we have the heat therapy. My sister said earlier has to do with the heating pad or hot water bottle to the lower abdomen, which can help relax the muscles and reduce cramping. With this one, whenever you are using a heating pad or hot water bottle, always remember to cover it. It shouldn't be the pad is so with like laying it on your lower abdomen so you cover all you make. My sister mentions an example that she was told to pour hot water bottle in so hot water into a bottle. You can also just get a sachet water, then you heat it in a microwave or boil it on the stove. So you just put it inside, you don't tear it, put it in a saucepan and add water, make it to boil. When it's hot, then you wrap with something and use it. That's another simple way we can also do that. And with the exercise, we have the normal swimming and walking and running, but then not to the extreme. We don't do that to the extreme. That's very bad. It can others feel dizzy and nauseous and all that during those periods. So if you do extra or make it too much, we are going to have some consequences. Then we come to the myth. With the myth, one that I would like to talk about is one myth that people believe is you can't do anything to relieve the pain. Well, I used to think that as well, but then growing up, I got to understand that there are lots of ways to relieve this pain, just as we mentioned earlier in our past presentation. So the truth is, several treatment options are available from home remedies to medical treatment, which we read earlier to as ways to relieve us of the pain. Then the second method is only teenagers get cramps. Some old people believe that they are not supposed to have cramps. When they have the cramps, they feel like it is menopause, but then they could be in their period and then have the cramps right before their menses or after that. So old women also get cramps, and then it's women of all ages, unless you are at the menopausal stage. Even with that, I hear most of them also have cramps, like pains and all that. So any woman at any age can get cramps. Yeah, then we have the exercise-based cramps, which can actually help manage dysmenorrhea symptoms. Example of the moderate exercise I talked about earlier, such as walking or swimming, can be an effective way to manage the symptoms of dysmenorrhea. Then cramps indicate a serious condition. Yes, like when you have cramps, it's common and usually used. Others to say that when you are having your menstrual cramps, you should stay in bed and avoid activities during your period. While rest is important, staying in bed and avoiding activities can worsen symptoms. It is important to stay active. You would be in bed all day and you realize that you still have the pain. You are using the hot water bottle and all that, but then you're still feeling the pain. And you keep taking or keep abusing the medication, forgetting that being still or lying at one place will not help with the medication working in our systems. So you just need to make some moves. You don't go by the fact that you have to stay in bed and avoid activity. Something I usually growing up, I used to be too, but when I'm in that period, I'm always inside. My mom will be like, so what if one day you get married and what are you going to do? You have a husband you have to feed, you have children you have to feed, but then you have the notion having menstrual cramps, so I'm not going to eat, I'm not going to do anything, just going to be in bed. Then who takes care of them? So that is a false myth. Then it also says some people also say that we shouldn't have cramps if we don't bleed heavily, and that is a lie. Whether you bleed heavily or not, you are going harms. Others to about the myth. Then, in conclusion, comfortable and disruptive, there are several treatment and self-care strategies. Women can reduce their discomfort and improve their overall well-being during their menstrual cycle, which we mentioned earlier, the ways to do that. Now, it says we should be concerned if we experience any of the following symptoms when we have the prolonged, that's when to seek medical help. So while menstrual cramps are normal, you should consult a healthcare provider if you experience one prolonged pain before and long after your period. That has to be questioned. It shouldn't be so. Then secondly, large clots in your menstrual flow. Yes, when we are having our menses, we do have clots during our period, but not to the extreme, not too much of clothes. So if you have this kind of large clothes in our during our menses, we should take notice of that. Then heavy bleeding. You know how you bleed during your period. So when it gets to a point where it's overbearing, it's too much. At every point, you have to change your pads. You can't you have to be using Pampers in additional to the pads. That's questionable. You need to see a doctor or a nurse to know what to do. Then irregularities in your menstrual cycle. Some like having to menstruate 3 days when they know they menstruate 5 days or 7 days. Then now it's not constant. They come 3 days and next time 5 days or two, two, three. That's not the normal range. If it is from 3 to 7 or 3 to 5, that's understandable. But 3 to it's not it's questionable. You need to find out why you are bleeding that way. Then pain during sex. When you feel any pain during sex or any sexual intercourse, you need to seek medical help. So with proper treatment, self-care strategy, which I said, women can effectively manage dysmenorrhea symptoms and improve their overall well-being during menstruation. It is important to know that the severity and frequency of these symptoms can vary from woman to woman. Of course, we are all not the same. There might be an underlying condition someone has, but then another doesn't have. So there is a difference between each of these. women, and then some women may experience other symptoms as well. If you're experiencing severe or persistent symptoms, it is important to speak with a healthcare provider to determine the cause and appropriate treatment. Thank you very much.
Thank you very much, Belinda, for that powerful ending. We've learned a lot today. We've actually learned a lot from knowing what period pain is to how many women it affects and who is involved and which women are not involved, to learning about the types of periods, all the way through to learning about the different emotions, the different symptoms that come up with having periods, be it the physical or the emotional changes, learning how we can apply some home remedies to relieve ourselves, and then finally being taken through some medical aspects, because sometimes it's not every period pain that can be managed at home. You need to see your doctor for some of the severe ones. And we've learned about the kinds of agents that are used by health professionals to manage some of the severe period pains. And then we've concluded with when we are supposed to seek the medical help we need. So I want to extend a huge thank you to all three speakers. They've done a great job. They've sat down, they've prepared their slides, they learned, they researched in order to equip us today with this powerful knowledge so that as women, we can be on top of our menstrual health. So we have just 5 minutes to 7. We promised that this session would be a 1-hour session, and so we need to stick to our time. I would now open the floor for questions from my audience. If you are comfortable, you are bold enough, you want us to hear your lovely voice this evening, you can unmute and then you ask your question. My speakers are ready. They are well prepared. They came for this very moment to answer any question, to clear any doubts, any confusions you may have. If you don't have a question, you have a contribution as well, we are very much open to your additions and your submissions. If you don't want to talk as well, or you are in a place you can unmute, you can just type it in the chat box. I will read it out and then we will answer it together. So time for questions. Anyone with a question, you can go ahead and then ask away. Thank you. Okay, so as no one is coming, yes, I have a question I want to ask for now. And I would direct it to Dr. Priscilla to answer that for me. Since you have shown yourself to be a menstrual health or hygiene advocate, empowering females to own their reproductive health. How or what's, let me put it like this, what is the role of men in helping women to manage their period pain? Because as we've established from the discussion, during this critical period of our lives, we are actually very vulnerable. We are not functioning at our full capacity, I would say, as women. This is not to even perpetuate any myths anybody may have that. I know there's some myths out there that when women are in their period, they have some deficiencies or they have some hormonal imbalances that doesn't make them worthy or qualify for certain things or to take certain decisions. This has nothing to do with hormonal imbalances. As we saw during the presentation, nobody talked about any hormones being imbalanced or anything. It's just that it's a chemical procedure going on, and there are hormones that are controlling the whole thing. And the upsurge and the downsurge of the hormones will come out, or it will show as different symptoms in different women, as we all don't have one body. But my question is to ask that how can men in general better provide care or support to women during this time, because we are not functioning at our full capacity in one way or the other during this critical period. So Dr. Priscilla, if you can answer that.
Okay. Thank you very much for the question. So during the presentation, I mentioned that menstruation also takes a toll on the emotional, should I say, emotion of the female. So during this time, she needs support. If you're her partner or her sister, this is the time to show that you understand what she is going through, because you have women at this time just breaking down in tears because their emotions are all over the place, and sometimes it's not always the case. But then this is where they need someone who can listen, someone who can understand, someone who will not downplay whatever they are going through. Also, another way men can help is during this time. Sometimes for some women, the pain is so severe they cannot get certain basic needs. Sometimes it could be a pad or even painkillers. Sometimes they cannot get out of bed. So if you're a man in their life, this is the time for you to offer that support. You can go get it for them from there. I know guys are shy to go and get pads, but there's nothing wrong with it. So if at this time the woman cannot get these things for herself, it will be just nice for you to support her in that way. You can also like get her things, food, that comfort food that help her go through this period. Every woman has what helps her. So if you're with her for some time, you know what she likes, and you can support her in that regard. So emotional support, getting her the what she needs, be it the heating pad, the pain reliever. Yes, any way you can help and show her that you understand what she's going through. There's nothing wrong with her. Yes, basically you get her, and then I think she can go through the period feeling better. Also, yes. Thank you.
All right, thank you very much for that answer. That was quite good. So, like Dr. Priscilla rightly said, as men, you don't have the opportunity to experience what a period looks like or feels like. So the emotional support, 100%, very, very necessary, very important. There's no need to downplay what any woman is going through if she's telling you that this pain is horrible, it's terrible. I need something for it. You have no business whatsoever saying, but is it not just period pain? Can't you just chest it? Or some of those comments, very, very downgrading comments that we sometimes make. You have no business doing that. What you can offer is to apply empathy, put yourself in her shoes, and then ask how you can be of help, where you can get her the comfort foods, the pain relievers, and be that emotional support. And it's not even just for your partner. You can be that emotional support to a female colleague, to a church member, to a sister. When you are doing that as a man, it's also training grounds for yourself, because eventually you will get married and you will have a wife who would one day have a period. And so in that way, you can be of support to the women in your life, and they would really, really be grateful for you, which is why it's even important that this particular session, we didn't just say, oh, only women should join. It's open for men and women to join. So I'm particularly very happy for the guys who joined today, that they've been able to learn so much, to understand the science behind period pain and how it comes about. So now that you know the reason for the pain, you are better equipped to also help us when the time arises. So there's a question from Enyonyam in the chat box, and Enyonyam is saying, please, I heard taking in too much NSAIDs can cause stomach ulcers. So in a situation where you are taking these NSAIDs every month, won't it cause stomach ulcers? So Miss Belinda, would you like to answer Enyonyam's question? Would you like to take it? Is Miss Belinda still with us? If Miss Belinda is not around, Miss Mary, would you like to answer Enyonyam's question? Oh, what's up with this on mute? Let me, okay. Miss Belinda, kindly try again and let me see.
Okay, yeah, I've been able
All right.
to do that. Most of ibuprofen, example, ibuprofen, those essays don't cause ulcer. Normally, the ulcers has to do with something different, a whole version. Ulcer is a whole different thing. But then one can be addicted to the medication if the person places it that way. One can be addicted to the medication, and if it has to do with ulcer, unless the medication irritates the stomach lining, leading to the inflammation and damage. So I don't know how to put it. But then what I would say, if it's the NSAID you are taking, maybe ibuprofen or the naproxen and all that, if it irritates the stomach lining, it can lead to inflammation and damage. And it could also happen when you are having an underlying cause condition as ulcer. You have the ulcer already, but then you keep taking the NSAID. That is not a good idea. That is when the doctors come in. That's when the medical management comes in to prescribe pain reliever, which can help with that effect. It might be that you don't have to take that medication always. They would look for something that will prevent the stomach, um, stomach irritation. So it can be something that it could be. I think we all know that during some menstrual periods, some people are being hospitalized and that really in the digestive system or the stomach. But then if we take it orally, the digestive system, and then but then and with that one, it protects the stomach lining, but then not going to cause ulcer per se. Ulcer has to do with the a sore in the stomach, the lining, the lining, sorry, the stomach lining being having a hole or being having a sore, but it doesn't have to do with medication. If you talk about addiction, I agree with that. You can't get addicted to the medication because you're always taking it during the periods. So if I don't know, but that's what I know. So if someone has something else to add, I think that'll be fine.
All right, thank you. Okay, I see, Doctor. Thank you very much, Miss Belinda. So, Dr. Priscilla, you can go ahead. I see you've raised your hand.
Yeah. Hello, can I be heard?
Yes, please.
Okay, so to add to what Miss Belinda said, I would advise that if you are taking these NSAIDs when you have when you're on your period to relieve your pain, you should make sure you eat before you take them because they can actually irritate your stomach, your GI. Yes, so when you are taking them, make sure you're not abusing them. So I'd advise that even before you move to taking the NSAIDs, which are the brufen and the rest, you should try para. Personally, para works for me. So I have no business going to take an NSAID. But for some people, they say the para doesn't work for them. So if you are taking these NSAIDs, make sure you are eating so that irritation that these drugs can have on your GI lining can be reduced. Yes, and make sure you're not abusing it. If you are taking it and it's not bringing any relief, then maybe you should seek medical attention rather than packing on the NSAIDs just like that. Yes, that's all I have to say.
All right, thank you very much for that addition as well. So what they've both said is true. So when you are taking the NSAIDs, you just have to ensure you are not overdosing it, because you took one dose and the pain has not subsided. You are just piling on and on. We need to be careful about that. So thank you very much. I don't see any other questions. Nyonyam also says thank you very much. So it means that her question, she's okay with the answer to her question, which is very fine. I don't see any other questions in the chats. And it's 10 minutes past 7. So in the absence of any other questions, unfortunately, Dr. Benedicta had to join a different meeting. So she would not be around to give a closing remark or anything. So in the absence of any other questions, I would call this meeting to a close. I'd like to thank my speakers once again. All three of them did a wonderful job. And then I would also like to extend a massive thanks to those of you who were able to join us. I hope that the session has been impactful as we intended it to be. You can go ahead and share your testimonials on your socials and on LinkedIn and tag the speakers. Tell us what you learned and what you will be doing differently from now on with respect to managing your period pain. Good evening, everyone, and have a lovely rest of your evening. Bye.